Hi, and welcome to Vitalleo. I'm Dr. Ben Lerner. We're in a series right now on how to increase your overall per visit collection average. And today we're going to cover something we call providing ancillary services. These are services in addition to chiropractic to radically increase what you're collecting as an average each visit. In this video, it's going to be presented by me, Dr. Ben Lerner. Let's go ahead and get started. Our goal with our clients is that they would collect more than $100 per visit as an average, something we call the CPV, the collection per visit average. You know, when you consider somebody goes to a normal medical visit and just for that assessment, which isn't much, they're going to pay on an average of $120 to $150 for them to do relatively nothing. And we're going to do a lot of work to get them well. So we believe you should be over that $100 line every time somebody walks in your door. And there's a number of ways to do it. What I'm talking about in this video is what we call ancillary services. What can you provide in addition to a chiropractic adjustment that helps to raise that fee, raise those average fees for every visit? The first doctor I worked for, you sort of got a package. So you started care, and I came from a very straight chiropractic background, so the packages I was used to, they just had an adjustment. And so in order to have over $100 per visit average, your adjustment would have to cost more than $100. And that's kind of hard to do. This doctor had this package of things that you got. So you came in for your visit and you got your supplements. You got maybe some supports or an ice pack, a pillow. And so when you looked at the average per visit for his plan, it was over $100 per visit. So I got to see right off the bat in my first job how you could drive those collection per visit averages up by offering some ancillary products and services that go along with the care. You know, many people have heard of Clarence Gonstead, an icon in chiropractic. Well, my mentor, Dr. Tom Owen, he worked for Clarence Gonstead. His family was a patient of Clarence Gonstead. And when he first went to the clinic, they were surprised that there was a lab. There was lab testing for the patients there. Based on those lab findings, you were given supplements or food recommendations in addition to, maybe one of the best adjustments you can get in the history of chiropractic, a Gonstead adjustment from Clarence Gonstead. At the front of that clinic, there was a gigantic golden cash register. And Dr. Owen asked Dr. Gonstead, hey, what's that giant golden cash register for? And Dr. Gonstead said, it's for all the money. Because obviously, even back then, he was probably collecting over $100 per visit based on not only a very powerful adjustment, but a lot of additional services. Hey, we'll be right back with the rest of this material. But as a reminder, check the description for links to our podcast, YouTube channel, upcoming webinars, and other ways to get our contact regularly. I want to share this quick story with you really briefly from a doctor who has worked with Vitalleo, and then we'll get right back to the content.
Hey, it's my pleasure to talk about another victory for a deserving doctor. This one goes out to my friend Dr. Donna. She practices in Colorado, and what's amazing about her is she is really a healer. She has forgotten more about getting patients well than I think I ever learned. But what's so great about what she's doing is she is an all-cash provider. She's not in the exclusive area of Colorado. She's not practicing in Centennial, where there's a lot of disposable income. She's in one of the poor areas of Colorado. But this young lady knows her value and knows her worth. She has maintained over a $100 collection per visit average as a cash practitioner in the poor part of the state for over 2.5 years. Thrilled for her, happy for her, and just really excited about the example that she sets for chiropractors all across the country. Well done, Dr. Donna. I'm proud of you.
I mean, we have many doctors who collect over $120 per visit on average because when you include a program similar to My First Boss or similar to Dr. Gonstead, with that sort of approach, you're actually adding in, once again, you're adding in other products, other services that when it all adds up and you divide the total number you've collected from the patient by the visits they've come in, we end up well north of that $100. And these are high quality products and services. When we talk about ancillary services, these are from organizations like Vitalleo Health, where you're getting the right nutrients into that patient's life to help not just with their case, but their overall health. We also have testing that a lot of our doctors do. For example, we have clients who just as part of your first visit, they not only ask you, when was the last time you were x-rayed? Has it been within the last 90 days? And do that x-ray, which is a service in addition to an adjustment as well. They ask them, have you had your inflammation and CRP testing? Have you had vitamin D testing? Because these are really foundational needs you have to be aware of. If that CRP is high, you have a radically higher risk of heart attack or stroke and other things like cancer. If D is low, then you're more susceptible to everything, including infections like COVID. And then, of course, there's ongoing assessments. There's ongoing education that go along with this testing, with these products. But when somebody adds an ancillary service like Vitalleo Health, the average care plan is going to be an additional $700 to $3,000 on top of the chiropractic care plan. Now you're talking about a cost per visit for those patients that may be $300 or $400 per visit on the average. So it's really not hard to see, with the sort of plans that include these ancillary services and products, particularly like an entire testing and series of products and protocols to manage the findings on that test, it's really easy to see how a practice can radically increase what they're collecting each and every visit on an average. Now, I came from a volume background. Some of you watching may know me from the guy that saw 2,000 a week and taught hundreds of others to see 1,000, 2,000 adjustments a week also. And in those cases, usually you see people only collecting, again, $30, $40, $50 at the most per visit. However, now we've really looked more to how do you help somebody who's seeing 200 a week make $1 million a year? In fact, how do you help somebody seeing $100 to $150 a week and make $1 million a year? Tell people that can't or aren't going to see thousands of people every month, but yet help them to put $500,000, $1 million a year in their pocket to take home to their families. So that's the whole goal of our program now. It's quality care at a high cost per visit without this need to see a mass amount of new patients. And again, it's not just a theory or philosophy, it's what we're doing with hundreds and hundreds of doctors. Give us a call, let us know how we can help. Bless you, and remember who you are. Hey, thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about Vitalleo and how it might help your practice, you can always reach us at VitalleoHealth.com. That's VITALLEO health.com. Bless you, and remember who you are.